In this video, we discuss meningeal metastases. It may involve the pachymeninges, dura mater, leptomeninges, arachnoid, and pia mater, or both. Contrast-enhanced MRI is much more sensitive than contrast-enhanced CT. When considering carcinomatosis of the dura mater, it is common in carcinoma of the breast. Manifests itself as focal curvilinear or diffuse contrast enhancement closely applied to the inner table of the skull, and does not follow the convolutions of the gyri. Focal segmental lesions may be difficult to distinguish from end-plaque meningioma. When considering leptomeningeal carcinomatosis, they produce linear or finely nodular contrast enhancement of the surface of the brain. They extend into the sulci and follow the convolutions of the brain. It may be indistinguishable from infective meningitis or sarcoidosis. It has commonly seen in leukemia, lymphoma, and breast or lung cancer. If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.